I'm going to introduce Russ Gronewold, the CEO of Bryan. He's going to talk about some of the great things that Bryan has going on to be able to help address this emergency with the coronavirus. Russ?
Thank you, Governor. I am going to just spend a couple of minutes talking about some initiatives that we have going on, some examples of what we're doing today. One of the things, of course, that's most important is not just taking care of our current situation, but planning for any surge that could happen. We hope it doesn't happen, but we need to plan for that. And we know that when you do that, the two things that happen most quickly, you run out of places to go. So we have to free up beds, and we've done that already, working collaboratively with CHI St. E's here in Lincoln, as well as Lincoln Surgical Hospital and others, to cancel elective surgeries effective tomorrow. So pretty much all elective surgeries in this particular area, following the lead also of what Omaha had done previously, are canceled as of tomorrow, and we're working through, of course, all of the specifics around that. The second thing that you start to see a shortage of in any hotspot is that of ventilators. And we know that ventilators become a premium when you get into the latter stages of care for a COVID-19 patient. One of the things that we had happen recently is we were replacing out some aging anesthesia machines, about 34 of those, when our director of surgery said, you know, these actually have a ventilator-like capacity built into them. What if we kept them and converted them over? And so, in fact, that's what we've done. We've already converted half of those 34 machines over by essentially separating the anesthesia portion from the ventilator portion. You take out the gas cylinder and the gas tubing and you put a HEPA filter in, and that's the short version of how you do that. And we now have 34 additional ventilator machines. That, coupled with what we had and some donations we've received, has allowed us to get to over 100 ventilators now, almost double than what we had previously. And we've also figured out, I think many have figured out, but we've also finalized the protocols for, if we really came to it, being able to vent multiple patients off of the same machine. So it really does give us much more capacity than what we had in the past. Also, I know there's been a lot of discussion for a long time about drive-through testing. Just a few minutes ago, we opened up a drive-through test at our south location on 27th Street at our LifePoint campus. So these are folks that have a prior physician order and referral for this kind of testing. It's not a show up at will. It already has to be somebody that's pre-screened and has an order from their physician, or has gone through our Easy Visit online test, in which case they can also get a physician order through that. Those are pre-scheduled. We're going to be starting with about 60 a day from 2 o'clock in the afternoon to 6 o'clock, so 15 an hour until we figure out how this ramps up. But we really think this is important for the public, for them to be able, for those persons in that particular situation, to get on the right course of treatment. Finally, we're spending a lot of time with our rural partners. One of the things I've learned about working with rural facilities and CEOs and communities over our years is that folks in rural Nebraska do exactly what you expect in a crisis. They don't run away from it, they run right to it. And so we have been working with about 50 rural facilities through what's called the Heartland Health Alliance. It's a consortium of rural hospitals, most of them small rural hospitals, to figure out what their plans are during this crisis, to figure out, do they have the kinds of supplies that they need? Do they have the kind of training that they need? And they're very forward-thinking on all of these things. And when we've been surveying them, they've said, we plan on keeping as many of these patients as possible until they get to the point where they need 24/7 ventilation. So we are working with them on what our transfer protocols would be, how they do that, and how they train folks, how they keep their folks safe, what is the messaging to their community, all of the things that they're going to want to do to take care of those folks in place. Some of them have more capabilities than others, but that's what we're working on right now, is to make sure that when they get ready to transfer to Bryan, they've done everything that they need to do to take care of that patient the best that they've been able to into that community. We also are trying to see whether or not we can extend our telemedicine. Almost all of them have telemedicine today through Bryan Telemedicine or another telemedicine organization. And so we're trying to see whether or not we can provide some 24/7 monitoring from a distance if we extend some of our pulmonology and intensivist services to that. So more to come on that.